Hello, I am Dr. Venkata Ramakrishna, consultant and head of spine surgery, Arete Hospitals. Today we are going to discuss about spondylolisthesis. What is spondylolisthesis? So you know the structure of the spine, and this part is at the lower back, lumbar region, which is the most common place where you have spondylolisthesis. So spondylolisthesis is the slipping of one vertebrae over other. If you see the unit of the spine, it's called as vertebrae. There are many such vertebrae which will form the whole spinal structures, and there's something called as disc which is in between the two vertebrae. Whenever there is a slipping of one vertebrae over the other, it is called as spondylolisthesis. So the reasons for spondylolisthesis. So usually the spondylolisthesis happens whenever there is a break in the pars interarticularis, which is a connection from posterior aspect of the spine to the anterior aspect. So whenever the connection breaks, we have loss of resistance, thereby the whole stress on the spine, there is a stress, shear force on the vertebra, and they tend to slip anteriorly. So this is called as spondylolisthesis. So what are the grades, severities of spondylolisthesis? It starts from grade 1, 2, 3, 4 and spondyloptosis. So each grade is categorized by the amount of slippage. Grade 1 is almost 0 to 25%. Grade 2 is 25 to 50% of the slipping. Grade 3 is 50 to 75 and grade 4 is beyond that. So what are the types of spondylolisthesis? There are dysplastic, which is called as poor development of pars interarticularis, which is commonly seen in children. And the other one is traumatic. So whenever there is an injury to the spine, the pars interarticularis tend to break if at all there is an impact on the pars. So whenever there is a discontinuity of the pars, all the shear force on the vertebra, they tend to slip anteriorly. So there is a second type of spondylolisthesis, which is traumatic. The third one, which is the most common, is the degenerative type. Because of the degeneration, wear and tear, there is a severe joint hypertrophy, because of which there is a constant pressure on the pars. So due to the constant pressure on the pars gives away. There's a breakage of the pars and they'll have spondylolisthesis. So what are the treatments for spondylolisthesis? So we have learned about the grades of spondylolisthesis from grade 1, 2, 3 and beyond. So if it is grade 1, the treatment mostly it is conservative. Conservative, which means with the medications, good physiotherapy, back strengthening exercises, and if at all the nerve is involved because of compression, in the mild cases we go for injections, and in severe cases, if it is grade 2 or 3, we suggest surgeries for them. The surgery includes fixation and fusion. So we put screws in both the vertebrae at the upper and the lower level, and we fuse the vertebrae with putting a bone graft which is taken from the posterior aspect. And sometimes when the disc space is not much, we tend to put a cage which is like a jacking up substance, so which is like a pillar. So we put cage as well as a bone grafts to fix it, so that in future there is no further slippage of the spine. So these are causes, symptoms and the treatment for spondylolisthesis. So know about your spine at the early stage and get rid of the further complications by consulting the doctor at the early stage. Thank you.